As we head into the Thanksgiving weekend, can you give us an update on when the visitor restrictions will be amended for our elders in long-term care? Many families are concerned about running out of time with their loved ones.
Yeah, and you know, I've said this before, I don't have a timeline. We are working every day to make sure that the right people are in place to support visits and that they're being done in a way that supports families across the province. There was some inconsistencies in some places, and the focus has been on trying to make sure that it's done in a safe and consistent way, that we have all the processes in place, and I can't really say more than that other than each facility is working on this.
Ethan, do you have a follow-up?
Yeah, just a quick one. Would consideration be given to designating some family members as essential caregivers so they can be allowed to see their family members?
Absolutely, and there is a whole provision for essential caregivers. We have defined that quite broadly, and it's up to each individual facility to make sure that essential family caregivers are included in the visits and that it's done in a manner that's safe. And if people have concerns or they feel that they're not being assessed properly by the facility that their loved one is in, there is a patient safety and quality office in each of the health authorities that they can go to get support and having that reassessed if need be.
In terms of keeping the vulnerable safe, going to long-term care homes, the people I am talking to, the essential visitors, is not being enforced well. They're lost. They can't get any kind of help. And they're saying that we're not the sick people. We can go in, and I know you're waiting to get more staff in there, but they're saying we can augment that staff. We can help feed people. We can help care for people. We're not sick, but they're being stymied about getting in there. So why can't some of the help be some of the family members who are very careful about their bubbles?
Yeah, and I do appreciate how challenging it is for people. Our challenges, and we can see it happening in some places, this virus is very pernicious, and when it gets into that environment, it can spread so rapidly. And there's two things about this. One is that the workers in long-term care, by necessity, need to care for all of the residents in that facility, or at least in their area. And so they do need to be in the facility safely. If we have one visitor for every single person in there, that increases the risk dramatically, and it increases the risk for the staff and for the residents in that community. So it is a very fine balance that we have to find in long-term care, and I understand that we're not there, we're not where we hope to be, and as we're heading into influenza season and respiratory season, it's going to be even more challenging for us, making sure that we have PPE to protect staff, to protect residents, to protect visitors. The downside is that when we have a slip-up, when there is an entry of the virus into a facility, it can spread so quickly and be so lethal, not just to the person that you're with, but to everybody in the facility. And so it is trying to find some balance in that risk. And, we're working our way through it, and it is very hard, I know.